So conventional surgery जैसे मैंने बोला उन्हीं पार्ट्स की हो सकती है जहाँ पे पहुंचा जा सकता है एक्सेसिबल है और उन पार्ट्स को रिमूव किया जा सकता है विदाउट अफेक्टिंग दी normal physiological functions of the body and chances of recurrence and metastasis is high. किसी की सर्जरी करते हुए अगर कोई भी एक आधा कैंसर सेल डिसलॉज हो जाता है ब्लड स्ट्रीम में चल रहा है you know move to any other part of the body. Article there is a newer concept or a newer some surgeons where they first do radiotherapy and then they would perform surgeries where they will heal up the cancer cells would reactivate career so that even if they are dislodged, so and to define the tumor and cut across the tumor during surgery also becomes very, very important. Chemotherapy, we all know, it would be effective mostly in the initial stages or middle stages. At the terminal stage, I believe chemotherapy is not effective, and then it has several side effects, which at times are more difficult to clear by the patient than actually the disease. So that is another thing. Radiotherapy, you could achieve good effects. It is a local treatment, but it can be possible only for organs which can be exposed to radiation. बड़ी बारी अगर internal organ की radiation, so then it becomes very difficult or would be affecting other organs as well. So breast, prostate, cervix cancer में तो radiation दिया जाता है. लेकिन brain cancer में radiation नहीं दिया जा सकता. We can all understand that it could affect the other parts of the brain. Similarly, lungs में it is not possible because heart बिल्कुल पास में पड़ा हुआ. So those type of limitations are there to radiation. So monoclonal antibodies is another area where people are working, and also with immunotherapy is also an upcoming area. But again, there could be systemic inflammatory reactions and some autoimmune issues for inside. So the conventional treatment, chemotherapy के साथ जो है उसमें issues are that there is a quick washout of drugs, so you have to frequently administer the drug and then higher doses. The drug is administered mostly IV or oral, and how much of it would reach the target site where the tumor is there is an issue. Then when you administer higher doses, so as reach effective concentration in the tumor site, then you lead to systemic side effects and drug resistance and metabolic also. So the option is targeted delivery where the nanoparticles any uh, uh, any system can be referred. So normally हम सोचते हैं 10 से 100 नैनोमीटर तक nanoparticle है, but under the newer definitions, anything up to 1000 nanometers, but where the reduction in size is producing a specific or a group, then you can call it a nanometer or a nanometer. We'll be focusing on one of these systems, which is solid lipid nanoparticles. So solid lipid nanoparticles are lipidic particles which are dispersed in an aqueous surface. I think all of you know about emulsion. Oil and water emulsion में oil globule है, पानी में dispersed. It is a तो imagine करो अगर oil की जगह पे आपने कोई high melting point lipid ले लिया जो कि room temperature पे solid. हमने उस emulsion को बनाया above the melting point of lipid. So then at that time lipid is melting. So lipid globules are present with water as the first affected and to space affected piece of the lipid and water. Now you let the system cool. तो आपका जो लिपिड था वो सॉलिडिफाई हो गया और वो सॉलिड मेट्रिक्स सॉलिड पार्टिकल्स लिपिडिक नेचर के हैं जो कि वाटर में डिस्पर्स्ड है. So that is what solid lipid nanoparticles. Initially we had liposomes. Several of you already know. अब liposomes में जो आपको matrix है वो mobile है, वो liquid है. It is a water which is encapsulated in a double layered phospholipidic crystal. उसमें इश्यूज क्या आते थे, लीकीनेस बहुत ज्यादा हो जाती है. सो ड्रग जो इनकैप्सुलेटेड है अपने आप बाहर निकलनी शुरू हो जाती है बिकॉज योर मैट्रिक्स इज लिक्विड. देन स्केल अप इज अ प्रॉब्लम. मेथड ऑफ प्रोडक्शन जो है आज तक उनको स्केल अप करना बहुत मुश्किल है. वी ऑल नो जब कोविड के साथ फंगल इन्फेक्शन शुरू हो गए तो एम्फोटेरिसिन बी चाहिए था और एम्फोटेरिसिन बी के लाइपोसोम्स अवेलेबल है. बट एट एनी गिवन टाइम नो इंडस्ट्री can have a very large scale production of liposomes. So that was the issue with liposomes. After liposomes, there was a second stage when people started looking at a solid matrix systems, and that is when polymeric nanoparticles came. And one of the advantage was that polymer is a solid, so it is more stable than liposomes. But polymeric nanoparticles had their own issues. One is that you always use an organic solvent. Second is polymer would not be metabolized in the body. Some polymers which are metabolized would produce monomers, लेकिन monomers कैसे dispose of हो रहे हैं body में से we are not sure. Would they be accumulating? So and then the amount of drug which you can load into the polymeric matrix was limited. So these were the limitations with polymeric. And then we moved on to solid was as a third generation of nanoparticles in the series of liposomes. SLS is the short form for solid. And the advantages they offer is that the lipid is a biocompatible material which is already present in the body. We take lipid in our food and it is metabolized facility and then we intake. So one is lipid biocompatible. Load on this lipid matrix is significant, up to 10 to 30% lipid weight. The third is the methods are like जैसे emulsification करते हैं उस तरह के methods हैं and a very simple equipment is high pressure homogenizing for production of solid particles. And most of the pharmaceutical industry जो कि emulsions बना रही है उनके पास already high pressure homogenizers. So scale up is not an issue. So safety, high loading, high encapsulation, capacity to carry hydrophilic and lipophilic drugs, and also the scalability. All of them have brought the focus to solid. So why nanoparticles or why solid lipid nanoparticles? So if we see we have a tumor cell which has increased cell division leading to increased demand for blood supply. As a result, angiogenesis हो गया. So angiogenesis or neogenesis is where new blood vessels come. And then these blood vessels, this leads to decreased density of endothelial cells in the tumor environment. And it can lead to damage of the tight junctions. As a result, tumor cells में enhanced permeability हो जाती है. So enhanced permeability से blood जो है वहाँ पे flow होता है and the cells and the lymph would pass in stasis हो जाता है. Circulation नहीं होगा. And this leads to certain other issues. So tumor cell has an acidic environment. There is hypoxia, as I said, there is enhanced permeability and retention. There are several metabolic changes that undergo that take place, and there is presence of chemokines in the tumor environment. So target nanoparticles, if you can target, they could be there to like you could introduce something where the drug would be released when an acidic reactive is when the particles come in contact with an acidic reactant. So there would be triggered release of the drug, or you could try and modify the nanoparticles so that they would be the tumor site. So for SLN specific nature, in itself assigns better particles. Then due to enhanced formulation and retention, the particles along with the blood would flow with the tumor and stay there. And there is a better cellular uptake also because of it. Then we have several for a drug, also for a nanoparticle. So first is that the tumors are huge. As I said, enhanced cognition and retention is there. लेकिन उस केस में although technically speaking, we feel that the nanoparticles can pass through the leaky blood vessels and reach the tumor site. But tumor is usually surrounded by a basement membrane, which includes pericytes, and as a result, limits the movement of the nanoparticles across membrane into the tumor person. Then each type of cancer has its own diverse phenotype or genotype, which makes the therapy complex. Of एक तरह की tumor के लिए design करते हो nanoparticles, then they may not be effective in other type of cancer. Then another interesting thing is the tumor के अंदर जो है pressure ज़्यादा होता है. So positive pressure है वहाँ पे. As a result, there is stasis of the blood brain पे रुक जाता है and it cannot flow. So and nanoparticles जो वहाँ पहुँच भी गए वो सिर्फ diffusion के साथ they can enter the tumor cells and there would be no other way of no active transport of the nanoparticles across into the cells. There were some studies where for one time they would administer an antihypertensive drug and near the tumor site. As a result of which, they said we would reach the pressure inside the tumor and then couple it with the chemotherapy drug to achieve an enhanced so, सब कुछ जो है वो एक हाइपोथेसिस से चलता है एंड हाइपोथेसिस जो बनता है वो नॉलेज से बनता है. So if you read literature, if you try and read about the physiology, the pathophysiology, the issues of the disease, then only can you think of what are the solutions to manage that. So then acidosis and hypoxia is there, which limits radiation therapy and scientific. Then tumor margins have a lesser pressure than the inside of. As a result, the intratumor fluid oozes out of the tumor, and this fluid will be carried. Then it can result in metastasis. और जो intratumor fluid dissolve करता है उसके साथ जो nanoparticles अंदर चले गए, they would also start coming out from the tumor. Then the extracellular matrix supports the extracellular matrix that supports tumor growth and metastasis. And because of the high osmotic pressure, it also seals out to lead the disease. The stone cells, which are normally which include basement membrane, fibroblasts, and other immune cells, which are otherwise in a normal functioning body, known to be anti-cancers. लेकिन कैंसर्स में वो स्टाइल हो जाते हैं एंड एज अ रिजल्ट दे आल्सो so that also so you could design drugs or you could design delivery systems which would fit the stroma and make it less hostile. So that could also be one way of managing. Then imaging of the tumor microenvironment, sometimes nanoparticles are also used for diagnostic purposes. So starting the stroma for early diagnosis could also be one way of efficacy of nanoparticles. Then the active immune system eliminates or can sequester nanoparticles because nanoparticles could be identified as foreign by the body. And as a result, their concentration. So that is another challenge to be overcome. So these strategies can be that you can optimize the surface. As I said, you could make them to coat with some polymers or use some lipids which would degrade in acidic environment or in the low oxygen and release the drug. Or you can reduce the size to a certain level where it would pass through the pores in the blood vessels and go to a side. Or you could assign a charge to and if the cell is oppositely charged, then maybe they would be uptaken. But again, there are different type of opinions about this. They say that it's only the surface of the cell which is charged. So if you use charged particles, they might reach the surface of the cell, but whether they will be uptaken by the cell or not, that is again an issue. So there have been studies where they showed that charged particles were good, but at the same time, there have been studies where the charged particles did not add any benefit. Then EPR we've already discussed. Then similar responses like radiotherapy, there hormone responses. But वो वही इफेक्टिव हो पाएगा जहाँ पे सर्फेस के आसपास ट्यूमर है ताकि आप बाहर से you can apply magnet and you can if you have a thermal responsive, so you can increase the body temperature and then that surface or around that surface. Solid lipid nanoparticles के advantages में the first is that you can select a lipid which mimics the natural biological membrane so that it can be optical by the cancer cell. You could add some ligates to it which have higher. So what सारे peptides are there which can be used as ligates and they are the targets. And the activation of the several of the chemotherapeutic drugs at times are unstable. They are prone to degradation or they are prone to high metabolism. So if you encapsulate them inside the particles, then you take the drug and actually deliver it at the tumor site where the drug will be released. So that can be a So I'll take you across an example from my lab where we prepared and loaded. So Processexcel is associated with medicines. There is a lot of cases also because of its EGP plug. So what is the plug? Say that initially the drug or the molecule is moves inside the cell, maybe concentration gradient or due to some electric transport or passive transport. But there are certain receptors or certain chemicals present inside the cell which would identify the drug molecule and give flux getting cells inside the inside outside. So there are certain type of proteins which are known for this, and there are other levels also. So PGP flux is also one of the vibrations. So and as a result, NPM should be activated so that docetaxel, which was initially active, starts the cells start becoming immune to it, and they are no more effective. The marketed product by the name of Texotier, docetaxel has very poor solubility. So they have solubilized docetaxel using 380 and this combination has severe side effects, which is partly attributable to docetaxel like some factor. So what I'm trying to solutions means these are the gaps. This is what I'm trying to address. So this would be my hypothesis. So what solutions I offer is that if I can add a natural or any PGP plus inhibitor along with docetaxel therapy, then maybe I can deliver more docetaxel inside. So that is what I'm trying to do. I included curcumin, which is a natural plus, along with and then we co-encapsulated docetaxel and curcumin into lipidic nanoparticles, and this is in an aqueous. So there are different methods of producing lipidic nanoparticles. You might use organic solvents, but there are ways where you can avoid using organic solvents. So what we used was the system, and it was the normal system. In addition to that, the beauty of the system was that it is autoclaving. And after autoclaving, the encapsulation and size remains the same. So it could be used for current. So curcumin complements the process curcumin का अपना इंग्रेडिएंट्स 50 है लेकिन in this case we added docetaxel to curcumin where the curcumin concentrations were low and we were using it as a PGP plus inhibitor. In addition to that, curcumin is also known as a chemosensitizer. So these are molecules which improve the efficiency of the chemotherapeutic agents or they make the cancer cells more sensitive to the effect of these chemotherapy. So that type of property also curcumin is known to possess. So we thought that it would complement the person, it would overcome PGP plus, and as a result would manage the exit. So this is the first part was that I highlighted the research gap. The second part is where I give my hypothesis that this is how I am going to address the problem which exists. So what would SLN do? It would enhance the bioavailability of both docetaxel as well as curcumin. It would improve the solubility and release more the whole including the predicate. There would be no clinical related seriousness because my selects are was in nature throughout it. The system is on. So we can check it and use it as well. So this is how the SLN looks like. The yellow color is present of curcumin. The only curcumin loaded nanoparticles had a size of 164 nanometers. When we incorporated docetaxel alone, it was 280 nanometers. But when docetaxel and curcumin were together encapsulated within nanoparticle, the size is 300 nanometers. Now, this is what I meant when I said that even a nanoparticle greater than 100 nanometers is also a nanoparticle as long as it is an effective problem. Individual transfer administered as such, not a cap. So, pan value is something the distribution around the mean, which is also given by the polydispersive index and case, non-usable less than 0.4. Zero potential normally there is a concept that a zero potential of more than equal to 25 would make stable because the charged particle would start repelling each other. But the way in which we measure zero potential, first of all, is not reliable because we dilute it, so we change the nurse layer and everything. And in addition to that, there are other reasons for stabilization or destabilization. And now the significance is not as much as we lay on the zeta potential. So although the zeta potential was in the range of minus 15 to minus 80, still the particles were formed significantly stabilized to the subsequent time. And these are the 10 images of the docetaxel and curcumin loaded nanoparticles have no magnification at a higher resolution. You can see that there are certain different matrix or different matrix along the way. So looking at the release, so texture clearly declined. So all of the drug was released within 24. While in case of release of docetaxel, either from the docetaxel plus curcumin-based loaded nanoparticles or from docetaxel, only docetaxel, the release was extended to 74. In fact, almost 100% release was achieved within 12 hours from therapy. आप देखेंगे 12 घंटे और 24 घंटे almost without concentration. And the curcumin was further extended up to 96 hours from the combination antibody. Then we evaluated its cytotoxicity, anti-cancer effects in cancer cell line. We used three type of cancer cell lines: triple negative, double negative, and the cancer cell line, the estrogen, estrogenic, glucagon spectrum. And in each of the cases, the efficacy was much better than pre-protective, where we could not achieve MIC, we could achieve minimum inhibiting concentration, but IC50 values were more than 160 nanometers. While when we incorporated these into solid lipid nanoparticles, again, we only lost the loaded, lost it excellent human loaded. And then we also used the peptide, as I said, at the ligand to these particles to improve their targetability chemical cell. So from 160 nanometers, the efficacy improved to 10 nanometers plus 1 nanometer of curcumin. And where we used a combination of doxycycline and curcumin and all peptides to target. So 2.5 to 400 times better efficacy in terms of ICM effects. This slide shows the step one to confirm the lipid nanoparticles. This in the cancer cell as well. So that they overcome the formation. And once inside the cell, then they will produce. So what we did was we used a fluorescent probe labeled and we used cancer cells with them which would stay in the nucleus of the cell. And along with it, we added immune fluorescence nanoparticles, and you would see these are different cell lines. And you would see that, so this is only dark staining, this column. So you see the blue color that shows that the cells are light because we can stain. And this is where we have fluorescent dye. So, but this filter is would give only fluorescent. And the last column is where we have overlaid the images. You have the darky as well as the fluorescent stain. So you can see that when we use only fluorescent, there was no uptake in the cell. We used fluorescent, and you can see some greenish blue colors here, here, and here. So there was some uptake. While when we also loaded it or ligated it with a peptide, then there was a significant uptake in the cell in each case. And this slide actually shows intensity of so pre-FIDC when blue color which is seen only very black. The pink color is when FIDC along with SNS is there, and the green color the columns are where we also restart. Then we performed pharmacodynamics on the we administered a single dose of to the network. So the with what we observed was the strength of in the form of lymphatic nanoparticles with all the down unit, dependent unit, and with the there was more than 800% increase in relative bioavailability in comparison to the market product exponentially. Although the maximum concentration was achieved in human time was the same. So if Cmax increases, then we should be worried because toxic effects will be there. But Cmax being the same or lesser, while the mean residence time increased from 2 hours in case of execute to almost 20 hours in the case of either of the two. So you can see this. The red colored line is formed here. EPS FLN, the document structure given in. So there is a version. This insect shows initial time points of 0 to 4 hours. It is an IV injection, so immediately the concentration is high. So you can see that Cmax is almost the same with slight variation in the three cases, but the mean residence time is increased. So then we induced breast tumors in animals, and we administered the drug for a certain number of days. So you would see this is the tumor bearing animal, and this is the isolated tumor from the animal. So it was this thing, and after treatment, different types of treatments. At the end of the treatment, you can see that in cases where toxicity plus treatment was administered as limited normal, along with the type of treatment, the tumor size reduced here, which is a very, very significant effect. So this slide shows the percent reduction in tumor for docetaxel alone for an lipid nanoparticle, docetaxel plus treatment. This is for this is normal tumor. This is when docetaxel loaded nanoparticles were there. This is the tumor when tryptophan was co-incorporated, and this is when the peptide was. So there was a 106 times reduction in tumor volume when docetaxel, curcumin, and peptide. When peptide was not used, there was a 10 times reduction in the tumor, and the docetaxel peptide showed a very good result as well. So these are the histology results. This is the tumor tissue, and this is when only docetaxel was it was treated with only the there is a significant restructuring of the tumor tissue towards normal, while the docetaxel plus curcumin and docetaxel plus curcumin and peptide loaded tumor are almost similar to that. We also determined a marker for cancer that is DNTP, and again there was significant reduction in these values. These are the stability studies results for 3, 6, 9, and 12 months under refrigerated condition and long-term stability. We also did accelerated stability studies for 6 months, and you would see that in mostly all the cases the particle size is maintained. The reduction in the API drug assay is insignificant, not more than 2.5%. So for the treatment it is higher, but it is not high for the treatment, but still it is within the allowed limits. So this is something interesting. The zone was the cells which were treated with lipid nanoparticles. We observed them under confocal microscope at around 1 hour. And what we observed was that this is how these cells were, they are targeting cancer, and they developed some connection in between them. Here also you can see. So these types of connections were there. So when we looked into the literature, we observed these results for answers for this type of question. And we that there is a term called tunneling nanotubes. And it was discovered for the first time in 2004, where people said that the cells of the cancers as well as the neuronal cells, they cross talk to them. And as a result, they develop certain protection to transport materials or also to communicate with it. And initially it was initially maybe it is said that these tunneling nanotubes are developed in metastatic cancer cells. So a cell which is sitting at one side can remotely interact with another. And they said that these tunneling nanotubes are developed in response to a stress signal. जैसे कि कोई कैंसर ट्यूमर माइक्रो एनवायरमेंट में stressor होता है, so chemotherapy is a stressor. They would immediately start talking cancer cells which are removed certain micron of distance. So they could transport some maybe resistant molecules across those tunneling nanotubes, or they could convey to a remote cell that there is a danger and you can trigger your resistance. So these type of things are happening. So water tunneling nanotubes is a thin long protrusions of cytoskeleton and plasma membrane between cells for transfer and communication. And they are up to a length of around 100 microns. So the question is, can nanotubes be transported across these tunneling nanotubes? This is what our observation was. So we started looking at those, and it was found that the cells which tunneling nanotubes is small enough. This is the cancer cells develop tunneling nanotubes, and they are transient for initial exposure of 30 minutes, 1 hour. That's why we observed this phenomenon at 1 hour after treatment. But at later treatments, we did not observe it. And how do they affect? So they improve biodistribution of, they could improve the biodistribution of nanoparticles from one cancer cell to the another if we want to use it as an advantage for cancer cells. As I said, initially they were identified where it was said that these tunneling nanotubes are a reason for memory. Now, can I use them for transfer of chemotherapeutic agent? Can nanoparticle be a stressor which would initiate the production of tunneling nanotubes? And then the same tunneling nanotubes, which were otherwise a protective mechanism of tumor, could they lead to the transfer of nanoparticles from one cell to the another? That is what needs to be observed and then is could be another area of research. So EMPs can be used favorably, as I said. It could be a bridge between the pathologically sick and the healthy cells for tissue cell repair via transfer of genesis or removal of damage. So this is proposed as the actual reason for production of genes. But what are the opportunities? Either you block this selectivity so that the remote cell does not become sensitive or does not re-trigger, or you can promote delivering some defensive tools to repair injured normal cells, or you could use it for specific transfer and redistribution of chemotherapeutics over the last few microns of the tumor micro environment. As I said, after या उसकी पेरिफेरी तक डिलीवर हो सकते हैं लेकिन इंटरनल जो ट्यूमर का कोर है वहाँ पे मे बी बिकॉज ऑफ हाई ब्लड प्रेशर मे बी बिकॉज ऑफ वेरी थिक कार्टिलेज ऑफ द एक्स्ट्रासेल्युलर मेट्रिक्स usually delivery of the drug is very difficult. So if you produce some sort of nanoparticles which initiate the production of tunneling nanotubes, so even if you reach the periphery of the tumor, still the nanoparticles would reach the core of the tumor also through this. So these type of studies are going on. The challenges would be safety of these tunneling nanotubes in different drugs. You could use a high throughput screening and cell culture release to identify good agents, or you could target proteins which regulate these TNT formation like the essential. Or you could use mechanical shock or directional ultrasounds to produce these changes. And as I said, can nanoparticles be a stressor to produce TNT? So this is one study I picked up where we demonstrated the creation of the tunneling nanotube, and these were no is something I think when it's easier what they said about the general problem. So teams, they everyone wants to win. So, but you have to work hard to win. So there are so many things contribute towards winning and we should always try to achieve. Thank you. There are any questions? Anyone have questions? Thank you. Thank you very much, ma'am. I think ma'am explained everything in very simple terms. If you have listened it properly, I have listened it all and I have learned new things also. Actually, I have given projects to the master students on this paper. Here also and last year also I have given 3 students are doing this work. And I have learned a lot. Sure, sure. What we have. First of all, मैं सबसे पहले तो अपना धन्यवाद देना चाहूंगी कि आपने अपना valuable time and the pharmaceutical departments तो मुझे तो बहुत thank you very much ma'am for coming. Now I request our principal sir to participate ma'am. I request Bhavna ma'am to also please join. Please. Yes, yes. Yes.